let's do this. Okay, joining me right now is Dr. Christopher Edwards from St. Luke's. And first question for you: you are a one of your primary specialties coping with or for stress in adults.
Yeah, so I'm a clinical psychologist. I work with both kids and adults, and a lot of the work I've done in the past is working with kids and adults in particularly stressful situations and coming out of trauma, coming out of situations like we're facing in our community with COVID right now, through the military and through other options in the work I've done. So, and helping people work through these situations.
Perfect. Okay, so the biggest question I have for you right now: what are you seeing in terms of stress during this pandemic that we're having?
So a couple different things. I think we're having stress in many different ways. A lot of the stress is just based upon the unknown. The COVID-19 virus is really scary to people. We see a virus that as a community, we've never heard much about. We saw when things happened across the world, and we thought, okay, that can happen across the world. And then when it's come here to the U.S. and kind of started spreading across the country, it's been pretty fearful for people. It's frightening. It's what are the symptoms? Do I have these symptoms? How do I know if I have the symptoms? And then we start to attach that with the side effects and potential death, and it's just really frightening because it's a feeling of powerlessness and feeling out of control, and something that we feel like we can't do anything about.
Yeah, absolutely. Now, so with this pandemic, it's obviously adding a lot of stress to people's lives.
Yeah.
Now, this is stress, of course, something we all know about, but with this added stress, tell us a little bit about how dangerous or harmful too much stress can be.
Well, that's a good question. So I think, stress is something where we're used to thinking about stress in terms of maybe I have a project that's due tomorrow, I have a homework assignment that's due tomorrow, or, oh my gosh, I'm going to be late for work, or is that the police officer I just saw that turned their blue lights on? Are they going to come get me? But that's kind of stress that goes away. This kind of stress that we're having right now is something that is not going away. It's a constant stress that's here right now, a constant in many different ways in terms of what's happening, of course, physically, the concerns we have, how it's affecting us socially, how it's affecting us potentially employment-wise, financially. That kind of constant stress like that leads to a lot of worry. And so the more we think about something, the more we worry about something, the more we kind of just consternate on something, what happens is our heart rate goes up, our respirations go up, our blood pressure goes up, and continued levels like that it does a pretty good number to our system. We start to get exhausted, we start to get tired. Maybe we don't think as clearly as we typically would. We have a hard time concentrating. We feel tired all the time. We may eat a lot. We may not be eating at all. For some people, may just some gastrointestinal upset just from being stressed all the time. It just really wears out our system much quicker than we're used to.
Yeah, I got you. Okay, so I guess we can say the big question for people right now with all this going on is, tell us some ways that we can cope with the stress that we're going through right now.
Sure, great question. I think, a couple of things to think about is, recognizing as human beings, we like to be in control. That's just kind of our human nature. And the more we're out of control, the more it's incredibly stressful to us. So one of the things we can do is try to establish as much control in our lives as we can. Try to stick to a routine. For those of us, if we're working from home or we're out of work, unfortunately, and particularly with our kids being at home, particularly for kids, it's really difficult for them. So try to establish a routine. It's getting up every morning, getting to a routine. If it's exercising, if it's getting to our work. For kids, they're home, eating at normal times, kind of have a lunchtime at a normal time, dinner time at a normal time. Get in a routine that we're getting up, eating, exercising, napping, whatever we typically do, and going to bed at the same normal time. Those kind of things will help us because our body will adapt to that and keep us in a normal routine. So it keeps our body feeling better physically and mentally. It helps us to stay in that kind of routine and gives us some kind of sense of control.
Gotcha.
So,
no, go ahead.
Go ahead. I was going to say, in addition, I think the things that we can do to try to control the amount of stress is, we can spend all day doing lots of research about COVID-19 and symptoms and finding out about it. I think if we can be cautious about that and make sure that if we want to check once or twice a day and look how many new cases are in Idaho and what should I be aware of, but looking at reliable sources, if we're looking at our local news for reliable sources, if we're looking at the CDC, the WHO website, World Health, to get accurate information and then let it go. And then get back into spending time with family, spending time getting caught up on things that we may want to get done around the house, getting into a good exercise routine. to kind of keep ourselves focused on other things. So it could be incredibly helpful also.
This might seem like a silly question for some, but why is self-isolation and self-quarantining so tough for so many people?
Oh gosh, that's a great question. You know, it's funny for people who are introverted. It's funny, you can see on like memes on social media. This is like their greatest thing come true. They're like, yes, I can stay by myself. You know, it's hard because for the most part, as human beings, we're social creatures. We like to be around other people. We like to talk. We like to interact. And we just, you know, if it's the people at the office we talk to every day, if it's the people that we're used to seeing at the gym, we get used to those contacts and we like that. We like that social connection. So now we're being told socially isolate, get away from people, don't be near people. That's difficult because we like to have that. And I think it can, with the stress that we have going on right now and a lot of the worry, you know, we're used to talking to people. We're used to processing our thoughts and our feelings by somebody, just a friend at work or just friends we talk to every day. You know, we work out with people, whatever, and we talk to them, and that's kind of our way of processing and thinking through all of our stuff. So without that, it can be pretty frustrating.
Yeah.
So what I tell people a lot is, you know, just because we need to socially, you know, we have to isolate ourselves and stay socially distant doesn't mean that we have to be socially isolative. We need to stay away from people. But we can still be social. You know, we just like we're talking right now. We can still keep up with people, keep contact with people. A lot of times in mental health, we talk about you know, things like, you know, Skype and all the badness of electronics and these kind of pieces. This is probably the one time you're going to hear mental health folks say, hey, you know what, use your electronics right now, get on your electronics right now, talk to people, communicate with people, use your electronics to do that. You're never going to hear us say it any other time, so take advantage of it right now.
That is absolutely true. All we've heard is the adverse of that for years.
Exactly, yeah. So once you're going to hear us do the opposite now. Exactly.
Now, let me ask you something else related to that, though. I mean, for someone like me, I'm a single guy right now, but I have my Xbox at home. I'm good to
Sure.
go. You know, I go home, me and my dog, we just hang out, take him for a walk. We're good to go. But there's obviously so many other people out there who live with others, whether it's a spouse, other family members, whoever.
Yeah.
A lot of them are being driven crazy by seeing these same people all the time. How about some ways to cope with that situation?
You know, great question. You know, as much as we love our family, our friends, we also need that we're used to being away from them during the day too. I think, you know, that goes back to too. I think the same thing. You know, it's okay to take some time to yourself. It's okay to lock yourself in your room for a bit of time. It's okay to, you know, go outside for a walk. Of course, making sure we're following the rules we should be following. You know, go outside for a walk. Take the dog for a walk. Go outside in the backyard for a while. It's okay to say, hey, you know what, I love you, but I need a little bit of space from you right now. We have to be willing and acknowledging that because as much as human beings, we also crave social connection. There's also a piece of us that needs a little bit of time to kind of decompress, think through things. So it's okay to say, I'm going to go to my room for a bit. I'm going to go for a walk for a bit. It's okay to say that and be open about that and acknowledge that. We have to be willing to do that to keep that communication open.
Yeah, perfect. Okay. Well, the last question I have now. We've asked so many doctors, health professionals this question, but just love to hear it from another health professional. Why, in your own words, is I mean, what's your message for those who are not practicing social distancing? Why is this so important right now?
Gosh, that's a great question. You know, we hear the term flatten the curve all the time. You know, and flatten the curve on a very basic level means, you know, our health systems, you know, if you think about an idea, someone, Jim Souza, who's our chief medical officer, talks about there's a difference between a tidal wave versus a flood. If it's a tidal wave, that totally wipes out our ability to get anything done. It takes out our infrastructure, takes out our buildings, does everything. With a flood, we can deal with that. We can put up sandbags. We can redirect the water. We can put it in a way that we want. It's still devastating, but we can control it. With social distancing, what that allows us to do in our healthcare situation right now is social distancing allows us to control the flood. It allows us to continue to contain and provide the care for people as we're doing right now without becoming overwhelmed. And that's what social distancing does. If we can socially distant and follow those rules that we're asked to do, it keeps this in a controllable state. If we don't follow that, we're going to be into a tidal wave of situations where we will not be able to provide care as we need to be able to do. And right now, it would appear, looking at the numbers, that right now the social distancing is helpful. Especially look here at Idaho, we have to really applaud the decisions that have been made here in Idaho, because the cases seem to be, social distancing seems to be very positive, seems to be helping, and our healthcare systems are not overwhelmed in any way. We're dealing with what's happening, so we're controlling the flood. I think that's a really good message for people to recognize is if we want to, if we want to do our part, if we want to maintain control and help ourselves get back to normal, we need to socially distance and follow those rules. That will help us get back there quicker. That's the one thing we can do as individuals.
Perfect. I'm glad I asked because that's an analogy to tidal wave that has not been used yet with, as far
Mhm.
as I know, everyone else. So that's a great one.
Great.
Arnie, sir, anything else that that you'd like to add about this situation or how to cope or anything else?
No, I think one thing to add is when thinking about children also, for children, this can be kind of a devastating thing too. I think as adults, it's important that we're communicating to our kids what's happening in a level they can understand. That, we have a medical situation that's happening, this virus that's out there, it's getting people sick. Um, it's something we should be concerned about and we should worry about, but something that, again, as kids, we can teach them to do their part. And that's washing their hands, following that, being socially distant and recognizing that piece. And that's incredibly helpful for them. And also with kids at home, homeschooling, keeping our kids on a routine and keeping them on a structure and throughout the day is the best thing we can do for them. Sometimes it can be easy to say, oh, it's just an extended spring break, stay up as late as you want, get up whenever you want. As much as that can seem kind of like the easier thing to do, that actually leads to they'll be more tired, they're more emotionally frustrated, it leads to more emotional outbursts, and will actually increase their anxiety level.
Gotcha. Okay. Anything else you can think of?
No, great. That's about
Okay.
it.
Okay. Perfect. Dr. Christopher Edwards from St. Luke's, thanks so much for your time today.
Thank you. I appreciate the opportunity.